This video will present the first robotic SPECT reconstruction for minimally invasive robot-assisted sentinel lymph node mapping. The involvement of lymph nodes in patients with early-stage cervical cancer is one of the most important prognostic factors of survival. Fortunately, in up to 70% of the women surgically treated for this cancer, no involvements of the lymph nodes are present. However, the radical removal of all lymph nodes is associated with a substantial treatment-related morbidity. It is significantly lower when identifying the sentinel lymph nodes (SLN) and limiting the dissection to these. For instance, SLN mapping can be done using fluorescence imaging, as demonstrated by NKI Amsterdam. While providing excellent margins, fluorescence imaging fails to visualize occluded lymph nodes, and only provides images once the nodes are exposed. On the other hand, radionuclides can be detected even when lymph nodes remain embedded in surrounding tissue. This surgery is one of the first interventions using a handheld gamma detector during robot-assisted surgery. The acoustic feedback represents the detected radioactivity. Combining three-dimensional tracking and radioactive counts, a SPECT-like volume can be reconstructed. However, the data acquisition is cumbersome, and requires a significant change in the workflow of the robot-assisted intervention. Furthermore, the images cannot be visualized within the surgeon's console, which requires the surgeon to pause the procedure, look at an external monitor, and then continue. For the very first time, our system allows the surgeon to use a gamma detector within the surgical site. The drop-in gamma detector is designed to fit through a trocar, and be picked up using a Da Vinci tool. We have added a pattern to the surface of the detector, to allow for vision-based tracking using the laparoscopic video. In this experimental setup, we use a phantom with two radioactive disk sources of cobalt, representing the sentinel lymph nodes. In the top left, you can see the surgeon's view, and the radioactive counts represented as red bars. You can see the scanning motion in the bottom left close-up view, as well as in the main view. As with every handheld SPECT imaging, the data acquisition can take up to 2 minutes. Tracking data is acquired by combining the robot kinematics and the vision-based tracking. After a few seconds of SPECT reconstruction, we can augment the surgeon's view with a thresholded SPECT image. In conclusion, we introduced a novel concept for robotic SPECT acquisition for minimally invasive robot-assisted interventions, and demonstrated the feasibility and imaging quality using several phantoms. The authors would like to thank Jonathan Sorger from Intuitive Surgical, and Jörg Traub and his team from Surgici for their assistance and valuable feedback. Thank you.